One thing is for certain, there is inflammation within the brain of autistic people or autistic kids. So, a study that was done by Dr. Christopher Exley looked into the brain of people that have died that were autistic, and he found that there were high concentration of nanoparticles of aluminium. And so he published this data. Now I'm going to give you the protocol of an established, world-recognized neurologist.
Hey Special Family, welcome back to another Fair Use Reaction video. So apparently there is a neurologist who uses a protocol to treat all forms of autism, and it has been very helpful. Why would I gatekeep this? So I'm here to share it with you. Let's take a look.
There is a notable rise in autism cases in recent years. Back in the 1990s, 1 in 10,000 kids was diagnosed with autism. But in 2024, 1 in 36 kids was diagnosed with autism. There are no known causes of autism. However, genetics, environmental factors, or a combination of both could be a cause of autism. Now, one thing is for certain, there is inflammation within the brain of autistic people or autistic kids. So, a study that was done by Dr. Christopher Exley looked into the brain of people that have died that were autistic, and he found that there were high concentration of nanoparticles of aluminium. And so he published this data. Now I'm going to give you the protocol of an established, world-recognized neurologist in treating autism. He's been treating autism for the past 20 years, and so this is his protocol. His name is Dr. Cicero Combre. He's a Brazilian neurologist, and so for him to treat autism is, first, you need to make sure that you're calming and suppressing the hyper-responsiveness of the immune system. Because autism is characterized by neuroinflammation, he gives a high dose of vitamin D3, 10,000 international units. Now this calms the immune cells down and it prevents the high expression of neuroinflammatory markers. Number 2, he suggests propolis. Propolis is connected to something that bees make, so it is in honey, raw honey. Now this is a powerful anti-inflammatory substance because it calms the immune system down. The third thing, and probably the most important one that Dr. Combre suggests, is to give oral silica, and the one that Dr. Combre suggests is monomethylcilintro, which he gives about 100 milligrams to 200 milligrams 3 times a day. What this does is it binds to aluminium and it makes it possible for your kidneys to excrete this aluminium from the body. Now, if the kid is hyperactive, what he does is he gives the kid 4 grams of glycinate. Of course, if the kid is too sleepy during the day, he cuts it down because glycinate will make that kid, it will calm the nerves down and it will make the kid sleepy. So this is the protocol of Dr. Coimbra in treating autistic kids.
Also, they have linked supplements that you can use for your kid to help your child. Let's take a look at what supplements they use.
These are some of the most powerful supplements or vitamins people that have autism may benefit from. The first one is folinic acid or leucovorin. Folinic acid is the over-the-counter version, whereas leucovorin is a prescribed version. Folate plays a huge role in DNA synthesis, DNA repair, and neurotransmitter synthesis. Now, of course, if you have low levels of folate in the bloodstream, you are not going to get your neurotransmitter synthesis, which will absolutely impact the symptoms of autistic people. It is also shown that the protein that blocks folate from entering the brain is high in autistic patients. For example, when they screened the levels of folate receptor antibody, which basically blocks folate from entering the cell, it was very high in autistic children. However, if you give folinic acid, it can bypass the folate receptor autoantibody, so it can get to the brain and synthesize your neurotransmitters. By so doing, it decreases the symptoms of the autistic people. The second one is vitamin B6. Now, vitamin B6 plays a huge role in neurotransmitters like serotonin. Now, serotonin is your happy hormone, without which you're not going to be happy. You're going to be very moody. In fact, people that are depressed take SSRI, which is in selective serotonin reuptake inhibitor. So serotonin is very important. It also plays a huge role in the synthesis of dopamine. Dopamine is the excitement neurotransmitter. And the third one is GABA. Now, GABA is your inhibitory neurotransmitter, which inhibits glutamate. Now, when you have B6, it basically regulates the adequate levels of all these neurotransmitters, without which you are going to have an abnormal neurotransmitter synthesis of these three. If you don't have them adequately behaving together, then you're going to have a problem. So by giving vitamin B6, you are going to regulate these three neurotransmitters and so decrease the symptoms of the autistic children. The third one, is vitamin D. Vitamin D has been shown to be very low in people that are having autism. When you supplement or when you give vitamin D to autistic people, you decrease inflammation in them, so you sort of like help alleviate the symptoms. Now remember, the fourth one, which also is very powerful, is called broccoli extract. This is because they do have sulforaphane. Now what sulforaphane does is it basically decreases the oxidation levels in the body of the autistic people. You decrease inflammation. You present a very suitable microenvironment, if you like, or macroenvironment for the brain to function properly. Yes, so these are your powerful vitamins and supplementations for autistic people.
So my question to you is, would you give this a try, or have you already? Is it working for you? Let us know in the comment section below, because we are dying to help our kids too, and each one teach one. So let's know in the comment section, and we'll catch you in another video. Bye.